So we have already discussed about the problems and the strategies to maintain a reproductively healthy society, the various types of contraception methods, sexually transmitted diseases. Now we will move on to our next topic, that is infertility. What do you understand by the term infertility? Infertility is the inability to conceive a child after a regular unprotected coitus. That is, can be of two types, primary infertility and the secondary infertility. In primary infertility happens when the individual have never conceived before, and the secondary infertility happens when they had a history of pregnancy. So there are various reasons for infertility. It may be physical defects, that is any defect in their reproductive organ. It can be genetic defect. It can be because of various diseases or drugs. It can be immunological defect or psychological defects. So couples who are unable to get pregnant can use special techniques known as assisted reproductive technologies, known as ART, to conceive children. So we will discuss about various techniques involved in assisted reproductive techniques. That is, the first one under this is test tube baby. When you hear the word test tube baby, earlier we had a misconception that test tube baby is developed in a test tube, but that is incorrect. We will look on to the procedure. Before that, the world's first test tube baby was Louise John Brown. She was born on the year 1978. This process was assisted by Dr. Steptoe and Dr. Edward. And India's first test tube baby was Kanupriya Agarwal. She was also born on the same year, that is 1978. She was also known as Durga. Now, in test tube baby procedure, an egg is taken and this egg is fertilized with the sperm of a father in vitro condition. In vitro condition means the fertilization is performed outside the body under laboratory condition. That is, whatever the condition is inside the mother's womb is given artificially outside the body or inside the laboratory, and the embryo is developed outside. Then this fertilized embryo thus formed is transferred into the uterus. Now this program is popularly known as test tube baby program, and the zygote thus formed is transferred into the uterus, and it can be done in two ways. The first is ZIFT, that is zygote intrafallopian transfer. Here the zygote at about 8 blastomere stage is transferred into the fallopian tube. The second one is IUT, that is intrauterine transfer. As the name suggests, here the embryo with the 32 cell stage or 32 blastomere stage is transferred into the uterus. Here the complete development takes place inside the uterus, and these two techniques are used when the fallopian tube is blocked or obstructed. The next technique is GIFT. GIFT stands for gamete intrafallopian transfer. As the name suggests, here the gametes are transferred inside the fallopian tube, that is the egg and the sperm. It is mainly done when the female body or the fallopian tube is not functioning properly, or the female produces sperm antibodies. So what happens here is egg and sperm is transferred into the fallopian tube, and it is done because egg is not properly formed. The next method is artificial insemination. It is done when male partner is suffering from a condition known as oligospermia. Oligospermia means less sperm count in every ejaculate. So here, sperm count will be less in every ejaculation. So in this condition, the ejaculates are collected together so that the sperm count will be more, and then this ejaculate is deposited to the vagina, and then it undergoes a natural process. Here the semen is directly put into the uterus. The next technique is intracellular sperm injection or ICSI. Here, the sperm is directly injected to the ova. So these are the techniques which comes under assisted reproductive technique or ART.